When I was first diagnosed, I had a problem. I couldn't swallow. So I went to see a doctor that I saw previously, a year before that, for essentially the same reason. And he said that I had some scar tissue. Yeah, lo and behold, scar tissue, 1 year later, almost to the day, turned out to be a tumor.
And it was one of those days that I'll never forget, when and where I was diagnosed. And just, it was a day that it really gets your attention. And it forever changes your life and the things that go with it. And stuff, I gotta be honest, I never even heard of esophageal cancer before I was diagnosed. And I got a heck of an education in a short period of time.
Finally, when I was diagnosed and they did all of the biopsies, I was then told that I had squamous cell carcinoma. They gave me the size of it and everything else. And then I went to Memorial Sloan Kettering, and I met with some fantastic doctors. And one of the things prior to that I had heard about was, the surgery, the life-altering effects of that particular surgery. So I was scared out of my mind. And I was with my wife, and Dr. Ilsen really, gave me this positive look and said, we do everything here to treat your form of cancer with medicine. Surgery is the last resort. Well, man, oh man, was that good news. I was surprised that they couldn't do something in the office when I was there. And instead, here it is that I've got to see an oncologist. And I'll never forget when she was talking to me about chemotherapy and radiation, and I kind of thought, that's everybody else does chemo and radiation. And then of course I'll never forget when I had my best friends and people with me when I sat in that chair for the first time and they put that port in my vein and the chemo started to drip, and I looked out the window of Memorial Sloan Kettering. I think I was on the 4th floor, and I just actually couldn't believe it. I couldn't believe it. And I only wanted to be surrounded by people that were positive, that people knew I was going to make it, because that's all I was telling myself, that we're going to beat this. It's not going to beat me. And I don't know if you can see, but in the background, but we're over here in Mystic and a storm just passed. And of course, there's that expression that goes, rather than waiting for the storm to pass, you need to learn how to dance in the rain.
I all of a sudden had this a gnawing feeling in the stomach, like hunger pains. And at first, if I ate food, it would go away and there wasn't anything, didn't think anything about it. And then after a while, it just didn't go away anymore. So my wife-to-be, who was an RN, said, you might be having an ulcer from all the plans of getting married. So she encouraged me to finally go to my primary, and I actually owe it to my primary care physician for saving my life, because she could have just sent me home with a bunch of samples and said, call me in a month or two or whatever. And she didn't do that. She says, I got a hunch here, because she knew my family history of cancer, and she knew of the situation of me, because I was with her forever. And she says, I'm going to send you for an upper GI. I'll just never forget sitting out in the car after the dust settled and it's time to go home, and it's just like, holy crap, I got cancer, and it just, from there, it was a big snowball effect. And we all sat down and said, honestly, the best thing to do here is to go ahead with surgery right away, because that's your best chance of survival. The feelings and how it was kind of a split deal. How were my feelings? Isolation and I'm gonna die and things like that. Because honestly, back 18, 19 years ago, we aren't where we are today. And certainly internet, and there's so many factors involved that are much more positive today than they were back then. And they let me know that, then that most people just don't survive. So they didn't hold back on that. And then and the thing is, how is it impacting my family, my wife? Here's my wife-to-be, and it's just like, is she gonna stick with me through this whole thing?
So when you go for your first follow-up, and they have to give you an endoscopic ultrasound, and you're under, and you're scared out of your wits that they're going to find something and they're going to turn the clock, the hands of the clock back when you think you've made so much progress and things are looking so wonderful, because now you can swallow again and you can eat slowly. You start to gain all your energy back and everything else. And I just remember how frightened I was. So we went to our first EUS after 3 months, and lo and behold, when I came out of the anesthesia, and the doctor came over, he said, "You're clean, everything looks good, everything looks good." I think I might have broken down and cried. And then I remember, I'm sure my wife cried. And then when we had the CAT scan to see how that went, and that was also NED, or it's a medical term for no evidence of disease, we were just overjoyed. And we had so much support from so many friends. The outpouring was absolutely tremendous. And when you feel so loved when you make it through that. And then 3 months, and then 3 months, and then 6 months, and then a year. And during all of that time, I've never, ever forgotten what it was like that day that I was diagnosed and where I've come today.
Anybody that's had the surgery or whatever, they call it scanxiety. And it's, you know, the anticipation of the test coming up, and then it's waiting for the results. Everybody goes through that. It would be more, it's normal to feel that way. It's not normal to not feel that way, because it's just all part of the program. And fortunately for me, there weren't any reoccurrences in the test. Every day, every test was not with a happy ending. There was a couple times where we had to do some modifications with my medications, because the stomach acid was causing problems in what was left of my stomach, or maybe my dietary changes. There was all kinds of little things, roadblocks here and there, but it's really important. I can't emphasize more to do what your doctors tell you and follow up tests. It's in your best interest, because if you don't and you think you've got it licked, more times than not, you don't.
But I'll never forget, it was February 9th, 2010, that I got hit with the bad news. And I am now, 5 years plus, in remission. And absolutely delighted to be here, alive, well, happy, again, at my favorite place, being able to share my experience with you.
One group that I'm a part of is the ECAA, Esophageal Cancer Awareness Association, and have been since its inception. We go out of our way to try to bring more recognition of the issues, the signs and symptoms, just anything about the disease, and anybody's attention we can, because, you know, most people don't just they don't just plop their feet down in the morning and getting up out of bed and say, "Hey, what a great day to get esophageal cancer." Most people never even heard of it, like myself. And I can't tell you how many people I've talked to that never even heard of esophageal cancer until they were diagnosed.